Another day, another story. A case of locally transmitted dengue fever has been confirmed in Hillsborough County, and experts say it was likely caused by a mosquito bite. Now, county health and mosquito control officials are urging people to take precautions to help avoid being bitten. Officials said the dengue virus was likely brought into the state by someone infected who had returned from traveling out of the country. Welcome to Tabo Eminent Channel. Once that person was bit by a mosquito locally, it would then become a carrier of the virus and capable of infecting someone else. According to the Florida Department of Health, this is the 8th locally transmitted case of dengue fever in the state this year. There have been 6 cases reported in Miami-Dade County and 1 in Pasco County. Officials with Hillsborough County Mosquito Management Services said they are spraying in the area where the case was reported. The department also has 11 field crew members who monitor known areas of standing water daily and spray in those locations when there is a new PTICK in mosquito larvae. Officials say the public can also help by removing standing water from property. That's why we ask the public to go outside, go look around your homes and businesses for anything that's holding water that doesn't need to, said Mosquito Management Services Director David Fease. Just dump it out and get rid of those containers. According to the World Health Organization, most people who get dengue will not have symptoms. But for those who do, the most common symptoms are high fever, headache, body aches, nausea and rash. This is the 18th dengue case in the county this year, but unlike the previous 17 cases linked to travel, this one was contracted locally from a mosquito bite. Health officials are urging residents to take extra precautions, such as eliminating standing water where mosquitoes breed and using insect repellent. The Florida Department of Health is also focused on educating those infected to prevent further transmission. In Hillsborough County, the confirmed case of locally transmitted dengue fever has prompted public health officials to increase mosquito control measures and educate residents about the importance of preventing mosquito bites. The Aedes aegypti mosquito, which spreads dengue, thrives in standing water found in places like storm drains and garbage cans. The Florida Department of Health is focusing on educating infected individuals to prevent further mosquito bites and subsequent transmission to others. Following the confirmation of a locally transmitted dengue fever case in Hillsborough County, health officials have taken several steps to mitigate the spread. These include enhancing mosquito control measures, particularly targeting areas with standing water where Aedes aegypti mosquitoes breed, such as storm drains and garbage cans. Public health campaigns are also emphasizing the importance of personal protection, like using insect repellent and ensuring windows and doors are secure against mosquitoes. The Florida Department of Health continues to monitor the situation and educate the public on dengue prevention strategies. Dengue fever, a mosquito-borne disease, has seen a significant rise in cases globally and in the U.S. recently. Florida, New York, and Puerto Rico have confirmed new cases, adding to the growing concern. As of early June 2024, the CDC reported over 1,700 dengue cases in the U.S., with the majority in Puerto Rico. Florida recorded 198 travel-related cases, primarily from Brazil and Cuba, and 7 locally acquired cases in Miami-Dade and Pasco counties. Globally, dengue is endemic in 90 countries, with 103 countries integrated into the WHO's dengue surveillance system as of April 2024. Factors such as climate change, population movements, and changes in serotypes contribute to the spread of dengue. The WHO assesses the global risk as high, necessitating robust surveillance and prevention strategies. In the Americas, the Pan American Health Organization, PAHO, has been actively involved in strengthening healthcare and outbreak response capacities. This includes deploying experts, enhancing surveillance, and supporting vector control efforts. PAHO emphasizes the importance of early diagnosis, timely treatment, and preparedness within healthcare services to manage dengue and other arboviruses effectively. The surge in dengue fever cases in the Americas has reached alarming levels, with significant outbreaks reported in several regions. In the U.S., Florida, New York, and Puerto Rico have seen notable increases in cases. As of early June 2024, the CDC has recorded over 1,700 dengue cases nationwide. Puerto Rico leads with the highest number of cases, reporting over 1,100, primarily in San Juan. Florida has reported 198 travel-related cases and 7 locally acquired cases, while New York has confirmed 119 cases. The global situation mirrors this trend, with the WHO highlighting an elevated risk of dengue transmission due to factors such as climate change and increased urbanization. The Pan American Health Organization, PAHO, has designated the current outbreak as a Grade 3 emergency, reflecting its severity and the extensive response required. Dengue fever continues to pose significant public health challenges globally, with a notable increase in cases in 2024. The World Health Organization, WHO, reports that 90 countries are experiencing active dengue transmission this year, with over 7.6 million cases, including more than 16,000 severe cases and over 3,000 deaths. In the Americas, dengue remains a severe concern. From January to December 2023, 4.1 million suspected dengue cases were reported, with Brazil, Peru, and Mexico among the most affected countries. The region is seeing a surge in cases due to cyclic epidemics, with all 4 dengue serotypes currently circulating. Efforts to control dengue are multifaceted, focusing on surveillance, vector control, and healthcare system preparedness. Organizations like the Pan American Health Organization, PAHO, and WHO are providing technical assistance and resources to strengthen outbreak response capabilities. In the United States, the number of dengue cases is rising, with 1,611 cases reported in 41 jurisdictions in 2024. Preventative measures include using insect repellents, wearing long-sleeved clothing, and ensuring living spaces are mosquito-free. The WHO has approved 2 dengue vaccines available in some countries, but no vaccines are yet approved for use in the US. Dengue fever is seeing a significant rise worldwide, driven by various factors including climate change, urbanization, and increased global movement. The World Health Organization, WHO, reported that as of May 2024, over 7.6 million dengue cases had been confirmed globally, with over 16,000 severe cases and more than 3,000 deaths. This marks a substantial increase from previous years, particularly in the Americas, where cases surpassed 7 million by April 2024 alone. Dengue is a mosquito-borne viral infection primarily spread by Aedes aegypti and, to a lesser extent, Aedes albopictus mosquitoes. These mosquitoes thrive in tropical and subtropical climates. Symptoms of dengue fever include high fever, severe headache, pain behind the eyes, joint and muscle pain, rash, and mild bleeding. Severe dengue can lead to serious complications and even death. The increase in dengue cases is also linked to global warming, as higher temperatures and increased precipitation create more favorable conditions for mosquito breeding. Preventative measures focus on avoiding mosquito bites, using insect repellents, wearing long sleeves and pants, and using mosquito nets. While there are some vaccines available, they are not yet widely accessible, and mosquito control programs remain the most effective means of curbing the spread of dengue. Thanks for watching. Request you to subscribe the channel.